Hi, everyone. Thanks for joining us today for the McMaster Institute for Health Equity seminar series. As you will have noted, this session is being recorded, and the recording will be available on our website and YouTube channel in the days after the presentation. After the presentation, we will have a Q&A session. At that time, we'll let you raise your hand to speak, and you'll be able to unmute yourself. You can also use the Q&A function to put your questions in during the chat. Now I'll turn it over to Dr. Jim Dunn, who's the director of the Institute, to introduce our speaker.
Excellent. Thanks, Lindsay. I'm going to start off with a land acknowledgement, and I want to give honor and thanks to the Haudenosaunee and Anishinaabe nations, who are the traditional inhabitants of the lands where McMaster stands. And to say that is to acknowledge a debt to those who were here before us and to recognize our responsibility as guests to respect and honor the intimate relationship Indigenous peoples have to this land. I'm particularly thankful of this, as I had the good fortune as a young person to roam the lands of this area and the territories that were the traditional homes of our of the Haudenosaunee and Anishinaabe, and that was very critical in the development of who I became, and I hope that I can continue to be a valid steward and participant in reconciliation as we go forward in stewardship of these territories. I want to thank you for joining us for today's presentation, which is part of the seminar series for the McMaster Institute for Health Equity. We're very pleased to have Dr. Roshanak Mehdipanah from our invited speaker series today, who's going to be talking about housing and health equity, which is related to our theme area in the Institute in housing and health equity. And Roshanak is an associate professor in the Department of Health Behavior and Health Education in the School of Public Health at the University of Michigan. She's also director of the University of Michigan Housing Solutions for Health Equity Initiative. Sounds pretty relevant to what we're doing. And which is focused on informing local, state, and national policy through interdisciplinary research on housing as it relates to equity in health, race, socioeconomic status, and aging. Very pleased to have Roshanak here today. Thanks again for joining us, and really looking forward to your remarks. So I'll pass the floor over to you. Take it away.
So hi, everyone. Thank you for having me here today. As Jim mentioned, I'm based at the School of Public Health, and I am actually raised in Canada. So I come from Toronto. I did my training at University of Toronto, then went on to Waterloo, and then I ended up doing my PhD in Spain. And then I somehow ended up at Michigan. So if you also have any questions about that journey, I'm happy to answer those later on. So today's talk is really going to focus on a recent study that we published earlier this year. And then I'll talk a little bit about what we're doing here at the Housing Solutions for Health Equity initiative. So my understanding is you have some background on housing as a determinant of health, but just to get everyone on the same page and some of the terminology that I'll be using, we talk about housing as a multidimensional determinant of health. And most of my work really focuses on the independent and joint effects of affordability, conditions, and access. And when we talk about affordability, we're talking about how much housing and its relative costs are, but in addition, what those costs are in relative to the household income. In the US, we often use the threshold of households paying more than 30% of their income towards any housing costs as being kind of the threshold. Anything above that is considered cost burden. And then in conditions, we're talking about the quality of the housing, everything from the water, lead in water, to holes in the roof, to mold in the basement, all of those aspects. And then access goes beyond monetary access to also include barriers that prevent someone from accessing home. And in particular here, I'm talking about some of the housing discrimination that folks can experience based on their race, gender, sex, ethnicity, socioeconomic status, age, and other factors too, which I'll talk a little bit about today. So it's important to situate where housing falls when we're talking about cities, neighborhoods, and housing and health. I started off in the field during a time where place-based research had just taken off. And over the years, I'm more and more convinced that although it's important to understand what's happening in a neighborhood, it's just as critically or more important to also understand what's happening at the housing unit. So we know that unaffordable, inaccessible, and poor quality homes all impact health negatively. But in addition to that, we know that neighborhoods with greater disinvestment are ones that lack resources, so access to everyday needs from food to education to even work and transportation are all key players. And we know that there exists ethnic and racial disparities when it comes to neighborhoods with when it comes to people living in neighborhoods with greater disinvestment. And in particular, we know that in the US, greater proportions of non-white racialized groups, particularly non-Hispanic Blacks and Hispanics or Latinx populations, tend to live in neighborhoods with greater disinvestment. And all of that falls into this kind of distribution of resources by the city, or in our case in the US, we talk about counties often. So counties would be equivalent to, I'm trying to think in Canada, not province, one level lower than province, but not city level. And I can ask Dr. Dunn to elaborate on that later. But in addition to that, we have largely overlooked the structural forces that have created and reinforced neighborhood inequities. So going back to what I mentioned, when we're talking about place-based research, when it first took off, a lot of focus was on, well, what are the current neighborhood conditions and why so it was around the time of like poverty by postal code or poverty by census tract, and kind of understanding how certain conditions in the neighborhood impact health. But the questions were lacking in terms of, well, why did that happen in the first place? What was that? Why is that neighborhood the way it is today? And what has been the structural forces that have led it to be where they are today? Okay. So I want to introduce you to historic redlining practices. And I know some of you might be familiar with this, but just to go over it. So in the 1930s, there was a big push of the new set of policies that were brought in post World War I that were really meant to revitalize the status or the economic status of the US, in particular, help middle class and the lower income classes succeed. And among one of those plans was the Federal Housing Administrator of 1934, which was really intended to make home ownership more accessible to middle-class Americans by providing them these low-interest, long-term mortgages. However, as part of the FHA, so it was a well-intentioned policy, but when it actually came to implementation, the FHA led to the institution of the practices of redlining. And what this basically meant is that neighborhoods consisting largely of people of color were then categorized as being financially risky and were excluded from obtaining mortgages. So what this meant is that by restricting access to affordable home ownership in these communities, and literally building walls, which I will show you some pictures of, such policies constrained housing choice among people of color, and then contributed to this long-term disinvestment in urban communities. People of color who then wanted to become homeowners were then restricted to very precarious housing land contracts. So it would even include, for example, a Black family would go to an existing homeowner. They would sign a land contract, which meant, very similar to a mortgage, they would pay them, but they wouldn't have the ability to kind of pay over time. They had to have that kind of money up front. And if they missed the payment by one day, literally by even a couple of hours, they would lose the entire equity in the home and they would be evicted, or they would not be able to purchase that home. And so there's a lot of history around some of these land contracts, which to this day exist, but in different forms and different ways too. So the practice of redlining was implemented by the Homeowners Loan Corporation, or the HOLC, which then created maps to classify neighborhoods by their perceived level of lending risk. So a green or an A was deemed as best, a B was deemed as blue or B was still desirable, yellow or level C was definitely declining, and D or red was considered hazardous. And as I mentioned, areas with a larger proportion of non-white racialized groups, primarily non-Hispanic Blacks, were then classified as hazardous for investment. And so basically what redlining did, it institutionalized neighborhood racial segregation and restricted access to home ownership for non-white racialized homebuyers. It's important to note, though, that redlining didn't cause segregation. Segregation was already happening due to earlier policies. However, basically the HOLC really solidified that process. And so, as I mentioned, people of color then turned to land contracts with no safety nets, where people could easily lose any equity built on their homes due to a missed payment. And so these are two maps from here in Michigan, from Grand Rapids and Flint. And as you can see the red area, the yellow areas, the blue and the greens, and then the reds concentrated throughout. And there's a really cool website that I'm happy to share later that you can actually zoom in on any state across the US and see these maps for major cities back then. So I think there were cities that had over a certain amount of population would then have these redlining practices implemented in them. So what does that mean? Why is this all relevant? It's a policy that was put in the 1930s and how it's still impacting today. So redline neighborhoods have since experienced long-term investment. And we've seen the long-term impact of racist structural policies with geographic specificity contributing to this racial health equity gap across the country. And research has already connected some of these historical redlinings with socioeconomic factors like credit scores and disinvestment, foreclosure. So we know that in areas with higher likelihood of redlining in the past have been associated with lower credit scores and higher disinvestment, higher rates of foreclosures, more chances of or risks for violence, and also physical factors like excess heat. And when it comes to health, they've also been connected to preterm birth and poor mental health status. So what we wanted to do was, we knew that all of these pieces were there, and there was some links to health outcomes. But what we wanted to really understand was how historical redlining was associated or is associated with differential health opportunities, which are reflected in economic, social, governance, physical, environmental determinants of health. And we focus on the Detroit metro area, which has a population of approximately 3.8 million, which consists of Oakland County, Macomb County, and Wayne County. And for those who are familiar with Detroit, Detroit actually sits within Wayne County. And so the DMA was among the nation's largest and most prosperous metropolises at the start of the 20th century. Is described by author Thomas Segru. Redlining practices of the 1930s really set the stage for the establishment of suburbs in the 60s and 70s, which I'll talk a little bit about in a second, but then lured white homeowners to move from the city to heavily subsidized suburban areas with lower property taxes. So then, along with the industrialization and globalization, these contributed to the loss of many manufacturing jobs. So we're talking about the 1960s, moving on to the 1970s, while a lot of the existing employment opportunities moved to the suburbs. So together, these processes moved economic resources away from the city and into largely white and wealthy neighborhoods. And by 2010, Detroit had lost close to 2/3 of its populations, and with it, much of its resources. So in Detroit, the city went from about 2 million down to about 600,000 people. And to just show you what that means, in 2020, Macomb and Oakland counties had approximately 11.7% and 13.6% non-Hispanic Blacks, respectively. Wayne County was 38%, almost 39% non-Hispanic Black, with 77% of non-Hispanic Blacks residing and living in Detroit City. So you can see here, the blue dots represent white residents. Each dot represents 10 people. So this was at the start of the 1930s, with certain areas more focused. And I talked about how segregation existed before the HOLC. So you can see there are pockets of higher Black neighborhoods. And then over time, you could see with the white flight, Detroit becoming more Black and surrounding areas or the suburbs becoming more white. And I talked about walls being built, or like the redlining, and some people don't realize that literally walls were being created to separate neighborhoods. And this is a wall that runs through 8 Mile that was built in the 1930s. And it's actually one of the only places in the country, because this happened across all cities across the US, where the wall has been kept as a reminder of the historical policies that had led to the redlining effects and disinvestment in communities. So we conducted an ecological study to examine the associations between historical neighborhoods, HOLC grades, and the neighborhood determinants of health, which we call the DOHI and the DMA. And to create actually, let me move forward. So I'll talk a little bit about DOHI in a second. So the HOLC scores were obtained from the University of Michigan's Institute for Social Research. This is a huge data repository. If any of you are interested in working with data, most of the data is free, or you must register and get an account for higher sensitive data. And so what we used is using digitized HOLC mortgage security risk maps from the University of Richmond Digital Scholarship Lab. Researchers at ISR then overlaid the HOLC maps with the 2010 census tracts. And this was really just done to determine the proportion of HOLC residential security grades within the boundaries of each census tract. So similar to Canada, we use census tracts to kind of as proxies as neighborhoods. So again, a numerical value. So 1, 2, 3, and 4 was assigned for green line, blue line, yellow line, and red line, respectively. And a historical redlining score was then calculated from the sum proportion of HOLC grades multiplied by the weighting factor based on the area within each tract. So this is just a fancy way of saying that the grades were determined based on how many people live there and what was happening in those areas. And so a higher HOLC score corresponded with a greater redlining in the census tract occurring. So to determine our DOHI index, we use the Detroit Urban Health Equity Assessment Tool, which was based on the Detroit Urban Heart. This was a tool that was developed by the World Health Organization to help engage stakeholders in a participatory process of developing indices that were reflective and relevant to their community. So we had done this process back in 2017, working with various community organizations to kind of come up with a list of different determinants of health that would fall within economic, social, governance, and physical environment, and establish those as predictors of both mental and physical health. So to give you an idea, these were some of the indicators that we used. You can see under economic growth, we used home ownership, occupied housing, income, employment rates, and then for social and human development domain, we used completion of high school education, children living above the poverty line. Within the governance domain, we used healthcare status, whether the individual had, or the percentage of individuals in the neighborhood that had public or private insurance. And then we also used factors for physical environment, which included diesel PM, which is based on PM10 emissions from on-road and non-road mobile sources burning diesel or residual fuels. And we also use commute time. So whether the percentage of workers with a commute time less than 30 minutes divided by the total number of commuters in the area. So to create our index, we use quantile scores. Were calculated for each of the variables. Quantiles are often used to categorize income and other socioeconomic measures when examining inequities across areas. So therefore, quantiles with higher values received a higher score. So the census tract within a quantile that had the greatest economic growth received a score of 5. We then summed these scores for each variable to create an additive index with higher index scores representing more favorable conditions for health across the 4 domains, and then ranging from 8 to 40, 8 being low on all indicators and 40 being high on all indicators. And then what we also did, we calculated the mean value of all census tracts by HOLC score for each of the indicators for the index, and our findings showed significant spatial autocorrelation, indicating that the observations are not independent and with identical distribution across the DMA. So this is basically to say that we had to then use spatial regression models using these inverse distance weighted matrix. I know this is too much detail, but essentially we also then adjusted all our models for changes in white population from the 1970s to 2019 to account for some of that white flight that had occurred. So I had shown you initially models, maps of Flint and Grand Rapids. This is a redlining map of the city of Detroit using GIS. And you can see that the Detroit boundaries are right here, and this still makes up part of Wayne County. You can see some of Oakland County up here, and then some of Macomb County on this side, with again green representing the best, blue representing still desirable, yellow representing definitely declining, and red representing hazardous areas. So this table shows us that neighborhoods that had been designated historically with an A level, I don't know if you can see my pointer, but this first column fared better across most contemporary indicators. So we actually saw a $60,000 difference in present day median household income between neighborhoods that were historically greenlined compared to those that were historically redlined. We also see an almost 30% difference in home ownership between these neighborhoods today. So here in this map, we illustrate the spatial distribution of the DOHI scores in the same HOLC graded census tracts. And here you can see that census tracts that appear darkest in blue represent those with the highest quantile DOHI scores. So those that are most successful or better for health outcomes. And then the lighter it gets, it shows the lower scores for those determinants of health that I mentioned. So a visual comparison of the two maps can show you that there's considerable overlap with the census tracts with HOLC grades of green. So here tending to represent darker or better scores and higher contemporary DOHI scores, as indicated in these dark blue, while many of the areas that were historically redlined correspond to lower or worse DOHI scores, with the exception of some, which I'll talk a little bit at the end. So in table 2 here, what we're showing is the results from the spatial regression models in which we tested the hypothesis of whether the HOLC scores are significantly associated with contemporary DOHI scores as captured in our index, while controlling for the percentage of change in white residents. And here you can see the results are shown for each of the 4 models using the red, yellow, blue, and green lined neighborhoods as references for each to specifically examine differences across all the neighborhood types. And so you can see formerly green lined areas have an average of a 9.25 in this first column, point advantage over formerly redlined census tracts after accounting for those changes over time in racial composition. So even till today, we see those benefits of green lined areas in contemporary determinants of health. So these findings kind of highlight the continued effects of discrimination in local policies that govern funding and resource allocations. So we know that structural racism in the housing system in the form of HOLC grades are now associated with the contemporary DOHI scores in the DMA almost a century later. And we see that those associations most visible were in urban areas of the DMA, since the HOLC grades were mostly implemented in urban communities. So they had to be areas of 40,000 or more. And we also see that formerly redlined tracts scored significantly lower on the DOHI compared to other HOLC graded areas, and that green-lined areas have accrued larger relative benefits in terms of social determinants of health compared to other HOLC graded areas. And so that's really important because this has implications for how we propose policy changes. Again, going back to what I discussed when place-based research came out. So again, Neighborhoods Matter research came out. A lot of focus was on disadvantaged or disinvested neighborhoods, and a lot of the policy recommendations were, well, more investment is needed in these neighborhoods. More better access to food is needed, better access to this is needed, which is a great conversation to start with. But when it comes to actually implementing it, cities have a certain level of funding available. And to talk about whether that investment comes in, we need to also talk about where that money has to come from or withheld from other areas. And that hasn't been part of the conversation. And so what has happened is you get investment in all neighborhoods, which still maintains that equity gap between higher income neighborhoods and lower income neighborhoods. And in particular, when it comes to counties, for example, in the US, counties have certain amount of funding, and it really then becomes who are the strongest advocates that then get a big chunk of that funding. And if we're talking about areas that are traditionally or historically disinvested, we're talking about a lot, they have been associated with lower power or less power in advocacy and to push for some of that funding. But not only that, but also property taxes play a role in there. And I know I'm just babbling on, there's a lot, but really at the end of the day, if we move forward to today, like if we fast forward to where we are today, I would even go a step further than say that housing is a determinant of health, but property taxes is a critical determinant of health, because the lower the property taxes, it means less power when it comes to funding and other resources within the neighborhoods, within the city. So I will break all of that down in the question and answer period if you have more questions about that. But so essentially, this project was really implemented because there was, we actually were asked by the American Journal of Public Health to do something similar along this line, because a lot of the research was just connecting redlining to health outcomes without a discussion of what was happening in terms of determinants of health. And so this paper really contributed to that gap, to then be able to say, well, it's not necessarily that folks that are in redlined areas have higher preterm birth, or there's a higher risk for preterm birth or higher risk for cancer and other factors. It's because of the long-term disinvestment that has led it to where it is today. So filling that mechanism gap in some of that existing research. And so I mentioned that I direct this Housing Solutions for Health Equity because really the goal was, and I know, so there are pioneers like Dr. Dunn who really started the conversations around housing as a determinant of health over a decade ago, but still today, housing, it's hard to explain to people that it is a determinant of health. And so this initiative was really meant to kind of fill that gap. And our goal is to inform local, state, and national policies through these interdisciplinary researchers on housing to, as it relates to equity in health, race, socioeconomic status, and aging. And so our work is to advance not only research, but also providing the evidence that local organizations and governments need to make informative decisions, and also training students, researchers, and faculty members through research opportunities, pilot grants, and public events. So we have actually just over 25 experts now across 6 schools, including architecture and urban planning, nursing, law, public policy, public health, environment and sustainability. We also incorporate 10 research centers and programs across, and we've been very busy trying to get more research proposals out to then be able to work with many more partners across the state. And one of our partners is actually the state, the Michigan Housing Authority, which I'll talk a little bit about the project that we're doing with them. But before that, these are some of the project areas that we focus on. Housing discrimination in the US in 1968, just 8 days after the death of Martin Luther King Jr. The Fair Housing Law was passed, which prevented individuals from certain, so it was based on color, gender, age, income status, disability, and other factors, and has expanded over the years to include other dimensions at the time of purchasing or renting a home. So it is a law that is often implemented by fair housing centers across the US and by the DOJ, the Department of Justice. And in addition to that, we do a lot of work on low-income home ownership, and more recently on how healthcare systems can address housing issues within their jurisdictions. We also talk a lot about vacant land repurposing. Detroit, Flint, and Saginaw, 3 cities in Michigan, have some of the, are in the top 10 highest vacant land cities in the US. So there's a lot of vacant land. As you can see there, the depopulation from 2 million to 600,000 has lent itself to a lot of land becoming vacant. And so there's a lot of discussions about repurposing some of those sites and what that means. And then more recently, we've also started doing more work on housing insecurity among university students. That is a big issue coming up, especially in cities like Ann Arbor, where we're located in. And then in addition to that, there was a big, if you're familiar or if you read some of the US news, there was an uptick of evictions during COVID-19, eviction filings in particular. Although there was a moratorium on evictions itself, filings still occurred. And those have great impacts on the kind of the trajectory of individuals, with huge hits on their credit scores and opportunities to rehouse themselves in the future. And then finally, tax foreclosure, which I can talk a little bit about if you're interested later on. Most of the time when we hear foreclosure, we think about mortgage foreclosures, which were the height or one of the big drivers, or it was the height of the economic crisis or the housing crisis of the 2009, 2010. However, in cities like Detroit, about 3 to 4 years later, there was a huge wave of tax foreclosures. And these were foreclosures on properties that had missed paying their property taxes for 3 years or more. And so to give you just an idea, about 1 in 3 households in Detroit were affected by some form of tax foreclosure, which then led to vacancy, which then led to blight and all those other stories that you often hear about Detroit. And so there's a lot of research on how to prevent tax foreclosures in the city. And these are just some recent publications. You can take a look at our website. And then, as I mentioned, as part of being at University of Michigan, we really focus on service to the state and locally. And so we've partnered with the Michigan housing authorities to conduct a statewide housing needs assessment, which is an update from the 2019. However, one of the reasons why we were kind of brought in to do this, and the big appeal, was that we are actually going to get to incorporate a lot of health equity discussions. And with that, we're bringing collaborations from the CDC and the Michigan Department of Health to discuss what can be some of those solutions around addressing housing insecurities, evictions, foreclosures, and those. So kind of thinking beyond just housing as itself to all of these other determinants or all of these other factors that it impacts. And here's the article that I just talked about, with a big thanks to Dr. Amy Schultz and our doctoral student, Caitlin, McVeigh, who worked on this a year ago or 2. Yeah. What is time at this point? And yeah, feel free to send me an email. I'll answer your questions now, but if you have questions and such, I'm happy to share my email. And yeah, I'll stop there.
Excellent. Thank you very much. Oh no, you did. That was great. Thanks very much. Really appreciate it, Roshanak. I'm looking for my hand gestures, but it's okay. Someone else will put up the clapping hands. Thank you very much for the presentation.
Thank you.
So, gosh, I mean, I guess the thing I take away from this more than anything is just how many different aspects of housing potentially affect health, right? So, you know, you've talked about quite a large number of, you know, from tax foreclosures, mortgage foreclosures, redlining, white flight, and tell me, well, I mean, I guess in Detroit, what are the priorities in your mind for making the most difference to health and the health determinants in terms of housing interventions?
That's a really good question. Even in the last 8 years that I've been here, Detroit has gone through a huge shift. So for the first time in, I think, close to a century, Detroit has become a renter dominant city. So up to just a couple of years ago, home ownership was much higher rates than rentership. And so they've shifted to a renter dominant city. But the problem with that is that there are no provisions really for renters. And we're talking about housing where the majority of the housing was built prior to the 1960s. So we're talking about, so lead abatement didn't hit until 1978. So any house before that, chances are that there's high levels of lead paint usage and very little remediation. From what we saw in Flint, we know that the infrastructure is really old, and that could have huge implications on the health of individuals. But in addition to that, we're talking about, many people don't know this, but Detroit is actually on swamp land. So it's very swampy. And so every time there's a huge rainstorm, we're talking about thousands of homes, their basements flooding. And we're talking about power outages, so very little opportunity to clear the flooding, which then we know within 48 hours can result in the formation of black mold. So there's multiple dimensions at play at this. So one was addressing why people were losing their homes, so home ownership. So I talked a little bit about property taxes. There was post tax foreclosure era, there was reassessments of just to very basically, it's very complicated, but at a very basic level, property taxes were a lot higher than they should be in the city of Detroit due to over assessments that were done. Recently, in the last couple of years, there has been efforts to address this. The city had been sued by ACLU and others, but the problem is many people have already lost their homes. And so there's now a lot more support for low-income homeowners who are at risk for tax foreclosure to enter into agreements to repay their taxes, payment plans essentially over time. So that has been one way to avoid tax foreclosures. There has been kind of policies implemented around code enforcement for renters. However, that actually hasn't happened because there isn't enough workers to do that. So I guess, I know I'm just talking, but priority wise, I think it's multi-dimensional. And then the other big issue with Detroit that makes it very unique is the huge amount of investment, foreign investment that was done. So people coming in, buying the land of in Detroit and sitting on it, and investors coming in and sitting on it and kind of letting it go. And that has led to some of the greatest blight in the city, impacting the housing value of homes around it. So there has also been policies put into place to prevent massive investment or investor-led purchasing. So I would say one of the quickest things to do is housing repair, and that is in play right now. There's a lot of more investment in housing repair. The Henry Ford Hospital System has implemented programs now too. So when residents come in, patients come in and they require roof investment or roof replacement and such, they are connected to services that will allow them to do some of that. So a lot needs to be done, to be honest.
Great, thanks for that. Maybe we can open the floor to questions now. Lindsay, you can monitor the Q&A. Is there anything? Oh,
yeah.
Good. We've got one from Fran. Thanks, Fran. Can you tell us about the surprise discordant areas in the two Detroit maps?
So the areas that don't match, right? Redlining to higher. So that was actually downtown Detroit. And the reason for that discordance is downtown Detroit has had some of the most heavily investment, primarily driven by the mayor. There is also a huge investment by Dan Gilbert and a huge investment by the Ford, GM, the big three, Chrysler, that have investment in the downtown area. So historically, most redlining areas within cities tended to be in areas that were more industrialized. So areas where most factories and manufacturers were located, which tended to be in the downtown areas of cities. Over time, as downtown areas have become more of economic development and investment for tourist opportunities and other opportunities, those traditionally redlined areas have now become some of the higher investment areas. So there's select areas that more investment has been done in, and that's why there's that discordance between the two. In that sense, I hope that makes sense. However, I do want to clarify, in other cities, that is also where most of the gentrification occurs. But we don't use the term gentrification in Detroit, other than select areas, primarily because we're talking about huge depopulation, and now some areas are getting repopulated, but we're still not seeing what's it called, historical residents leaving, or residents that have been living in those areas leaving just yet.
Other questions? Go ahead, Lindsay.
Yeah, could I ask a little bit more about that, Roshanak? So you said you haven't seen historical residents leaving yet. Is this because of the depopulation, where there's still, you know, or is it because rents are still very affordable, or like or is it just these? Yeah. Oh, sorry, I'll let you answer instead of speculating.
No, that's a really great question. So Detroit residents who didn't leave in the last 20 years are less likely to leave now due to the deep roots that they have in the cities. That's one aspect of it. The other aspect of it is that a lot of folks are still stuck in place. So we use that term stuck in place is that their houses haven't appreciated as much for them to be able to sell and then purchase another home in another place. So although housing values are starting to go up in Detroit, other than certain specific areas, that hasn't been the case across the city. And so people are not able to sell their properties that easily and then have a large enough investment to then go somewhere else and purchase a home. And so that has been another reason why a lot of people haven't left. But a lot of people did leave in the early 2000s leading up to the bankruptcy. Detroit was actually it's the only city in the US, I want to say, that declared bankruptcy. And so that's that aspect of it. I do want to say though that in all my work around the different cities that I've lived and worked in, Detroit residents are among the most resilient folks I have ever seen. and Detroit community organizations are among some of the strongest I have ever seen. We talk about community benefits. Detroit organizations are huge in advocating for community benefits. And so that has been a really big push to making sure that the voices of Detroiters are at the forefront of some of these discussions.
Other questions for Roshanak? Go ahead, Lindsay. Yeah, go for it.
Roshanak, you also, if I understood this correctly, you said that in the last few years there has been a shift from home ownership domination to rental domination. What was that like? Was that COVID? Like, what was it that that changed that in the last few years?
So it wasn't necessarily COVID. This happened right before COVID, but essentially what happened was the tax foreclosures that occurred throughout the city. So traditionally, Michigan had a law where there could be tax delinquency for up to 7 years, and then the home entered in a really kind of harder process to actually foreclose on a home and such. So in an attempt, the state, in an attempt to make sure that homes were not being abandoned and repurposed and brought back into cities in their property taxes and contributions and such, they shortened that 7 years to 3 years. And so any tax delinquency beyond 3 years, and we're talking about tax delinquency, people think like thousands of dollars. I've done research on homes that were tax delinquent by like $20 or $30, $100. And oftentimes people didn't even know these taxes were on their homes. And so they entered into losing their homes due to this foreclosure. And so what would happen is at the end of 3 years, any tax delinquent homes would have their homes taken away and put into a tax auction process. And at the tax auction, the home would sell the first round if it's sold at auction price, whatever it was deemed. And then at the second round, I think it would go down to about, actually, I'm not 100% sure, but at $500, I think was the basic. And so that's where investors would come in and purchase hundreds of homes, hundreds of lots in one go. And there was this idea that if investors came in, they would invest in the land, but what would happen is that oftentimes these investors would just sit on these homes and the homes would deteriorate, and then after 3 years they would go back into the tax foreclosure process and tax auction again. So it's a lot more, and I'm happy to share resources. I'm oversimplifying the whole process. But Margie Dewar, who's one of my mentors, has written extensively on this process and this investment that has resulted of some of these factors, powers of play.
I'm sorry, I didn't quite catch why did the policy I just didn't quite catch it. Why did the policy why was this change made?
So because there was so it was to bring back the homes into the property taxes, so they would recontribute property taxes to an already pretty depleted plot of money. So
they're trying to solve one problem and then just the sort of an unintended consequence maybe, or
exactly, to prevent abandonment, prevent all these other issues.
Wow.
And so what's the state of depopulation these days? Is it still continuing? I mean, one of the things, of course, that has driven sprawl is just ever expanding urban boundaries and so forth. But I know there has been a little bit of return to the city, if you like, by more affluent populations. Where is the state of that, and what impact is it having? I mean, it almost seems as if it could have oddly negative effects.
I mean, I think it has kind of stayed pretty much like there has been spikes and upturns. I think COVID contributed to some additional folks leaving and people coming and investments differing and such. But I mean, we're talking about a huge depopulation. I think it's one of the cities with the greatest depopulations. We talk about legacy cities. So these were cities that were high in industrialization. But Detroit is probably one of the ones that took the hardest hit. Along those, Cleveland, we've seen from Cleveland more people coming in investing. So I will say that there has been more investment and more push to grow. In recent years, Detroit has gone for larger bids like the Amazon bid and others, and then again attempt to bring in more folks. But I think that climb to repopulate is going to be a little bit slower compared to other areas. Folks that work at, there is a huge mismatch in so while Detroit is bringing in more businesses, GM is still there. I mean, the big three are still there. Research has shown that folks are traveling really long distances or commuting to work at these places, but then leaving the city. And so anytime you have that, and then you don't have that consistent investment in local businesses and other opportunities to help the cities grow. So there has been efforts. I think Henry Ford is trying more and more to bring in more folks through employment and others, incentives to have people live within the city and others too. And I think the mayor has really pushed for more infrastructure and other opportunities for folks, but it's very complicated, I would say.
For sure. One of the other things that I thought would be worth mentioning, just because of the Canadian audience that is here, is that the importance of lead paint usage is, doesn't have the same importance in Canada because it was regulated much earlier. And so I know it's a huge issue, and certainly, my now very long time studying housing and health, I've read many papers on lead paint and lead exposure, especially in children. What's the state of programming in that? I mean, it strikes me that, one of the things that might be, are there programs to do lead abatement? How generous are they? Are they having any impact on revitalizing some of the existing housing stock that might allow for neighborhoods to be inhabited that weren't previously, or that are experiencing population decline?
Yeah, I mean, lead remediation programs exist. Oftentimes when children are showing up to hospitals and such, and they have high lead levels, and it's then determined that it's through lead paint and such, then they are referred to programs. So there are existing programs led not just by health systems, but also different organizations and such to do it. But what plays kind of a role here is that, so there's a couple of things. In Michigan, housing inspections are kind of mandatory when you do through a mortgage foreclosure, through a mortgage. If you want to get a mortgage, you have to have a housing inspection, which then checks for lead paint. The other thing is that an owner has to declare whether there's lead paint in the home. So what I'm bringing to this is that as a homeowner, you're well aware whether there's lead, and then you can access programs and such. But as a renter, it's a whole other story. And as a renter, to test for that, you would have to invest your own resources. And then once you do find it, it's a conversation with the landlord. And so a couple of my colleagues did a study a couple of years ago where they found that housing that was primarily by larger investors were also houses that, landlords. So those landlords were more likely to have higher levels of lead paint in their homes. that hadn't been remediated. And so we're talking about, again, a renter population being impacted by this factor.
Yeah, so there you go. Well, we're going to wrap it up here, but that's I think a good place to wrap up, because it's the sort of double or triple burden, if you like, of lower socioeconomic position. So on the one hand, as I'm fond of saying, low-income people live in the least expensive, least desirable housing, wherever that may be in the city. And not only that, they're probably more likely to be exposed to some of the biological, chemical, and physical hazards that can happen in rental housing. And they are the least able to take action to ameliorate those things. And so it's an ongoing problem. That's a sequence of things I've been saying for easily 2 decades. And unfortunately, we're still in a state where it continues. And it's just amazing to see how an environmental policy like that, which was sustained, the regulation of lead in paint was actively resisted for an incredibly long time by industry. And it wasn't, as you said, it wasn't until 1978 that it was ultimately overturned. And it was, yeah, so there we are. Well, thanks again, Roshanak. Really, really appreciate the presentation. It's amazing all the great work that you're doing. It's just a really, really full research program, and we were all delighted to hear about it. And so now I've got some instructions that I have to read, which is that just to let you know that I want to thank everybody for joining us today. Let you know that the presentation will be sent out to everyone who's registered in the coming days, and it'll be available on our YouTube channel. And a reminder to students in Dr. Singh's course to please reconvene after the presentation on the separate class discussion Zoom link that Dr. Singh provided. Thanks again. Take care, everybody.